Good afternoon, everybody, and thank you for joining us. We wanted to share some critical updates on North Carolina's efforts to fight COVID-19. As of today, North Carolina has 3,426 confirmed positive cases and, sadly, 53 deaths. We've learned that test results have revealed a hotspot of transmission in Orange County. A series of tests for COVID-19 have revealed that at least 60 positive cases in a skilled nursing facility in Orange County, with more likely to come. Of those, 7 are hospitalized and 2 have died. These are shockingly large numbers. And I wanted to share some information about what the state is doing to combat and control outbreaks at long-term care facilities to protect both residents and staff. We're tracking these outbreaks closely because we know that by nature they can be hard to control. As our concern has grown about long-term care facilities, the North Carolina Department of Health and Human Services has added data to its public dashboard. One of the items being tracked and shared is the number of outbreaks at congregate living facilities, nursing homes, residential care facilities, and correctional institutions. And we are taking steps to safeguard people. First, we have to do everything possible to prevent an outbreak to start with. My earlier executive order has restricted visitors to these facilities, and the Department of Health and Human Services guidance suggests that workers wear protective gear and monitor their health. Direct guidance on closed shared common areas and sanitation are also in effect. Dr. Mandy Cohen has and will issue additional directives that she will talk about in a minute to address this situation. Second, we've accumulated enough testing supplies to respond quickly and aggressively to assess patients and staff in these situations. And this is important because we know that this virus can spread even before a person is showing symptoms like a fever or a cough. This increased testing will tell us which employees or residents may have the virus but aren't showing symptoms so that they can be isolated. And third, we must take immediate action to stop the spread of COVID-19 in this facility and others. In coordination with local and state health departments, facilities that have residents with the virus will group them into a separate area of the facility to make sure that they are cared for by a separate group of staff. This will prevent interactions with residents and staffs that are not COVID-19 positive. The increased number of cases highlights the importance of our work to get more hospital beds and the medical workers to staff them. Yesterday I talked about several upcoming executive orders. One of those will be signed today. That order allows more health care providers into the system, and it makes sure that equipment and other resources are available where they can be most effective and save the most lives. The order also increases the number of hospital beds that may be needed for this crisis. In addition, the order streamlines child care rules to make
tested, and then what changed procedurally inside that facility in regards to that patient and then others once they started showing symptoms. How did staff respond in this case? Thanks.
We're really concerned when an outbreak begins at a congregate living facility because everybody is so close together, and the steps that many of these facilities across our state has helped to prevent a number of outbreaks and has helped to slow the outbreaks that have occurred. But I'll let Dr. Cohen talk specifically about this nursing facility.
Yes, thank you. So as you know, an outbreak is any time you have 2 or more cases. So the first time we were aware of 2 cases, I believe, was about 7 or 8 days ago at this point. At that time, they're working with their local health departments on some of these activities that we've talked about today, making sure that staff is wearing masks, cohorting patients, and doing testing. As we have seen in other nursing home settings, this virus is very contagious and moves quickly, and sometimes can be spread before you even know folks have symptoms. That is, again, why we are codifying in an executive order some of these prevention methods so we can protect folks on the front end, because we know once the virus is in some of these long-term care settings, it's incredibly hard to control. We are trying to beef up our efforts to do those control measures, but it's incredibly challenging, as we've seen not just in North Carolina, but around the country and around the world. So I think prevention is really our important focus here, which is why we're codifying that in the executive order. And we're going to continue to work with our facilities and our local health departments to support them. And I just want to reiterate again how thankful I am to the workers at these long-term care facilities for doing the hard work that they're doing. It is very, very hard to do infection control in these kinds of settings, and I'm appreciative of all of that they're doing.
Thank you. Next question, please.
Allison Smith, Fox 8.
Hi, Governor Cooper. I know we have seen some retailers already enforcing their own restrictions on limiting shoppers. I'm just wondering, are you all considering a new state order that would limit shoppers inside stores, encourage more social distancing at these essential stores that do remain open right now?
We know that people have to go out and to get groceries and other essential items, and we want people to be as safe as possible when they go. A lot of employers have been very responsible in limiting the number of people in their stores at one time. In fact, limiting it to one entrance, and when the store gets to the occupation limit that the store has set, that you can't let another person in until a person has gone out. And they do have a place for people to stand in line with markings 6 feet apart, so people will not only be socially distant inside the store, but also waiting in line. We commend that, but we think it needs to be across the board in our retail stores across our state. We're encouraging retailers to do that, and we will be issuing an executive order that makes this more uniform across the state, sending the message that in order to protect both the customers there and the employees who are working so hard at these stores, trying to make sure that essential items are available for people, we want both of those groups protected. So it will likely be tomorrow that we would release that executive order for retailers across the state. Thanks. Next question, please.
Dawn Vaughn, News and Observer.
Dawn, are you there?
We'll try Haley Fixler at WGHP.
Hi, Governor Cooper. What is the plan with vehicle inspections and the DMVs? People are worried about getting exposed and being around people, but they're really also worried about getting the fines if they don't go.
I'm sorry. I could not understand the question. Can you repeat the question, please? I'm sorry.
What is the plan with vehicle inspections and DMVs? People are worried about getting exposed and going out and about and being around people, but they're also worried about fines and getting tickets if they don't go.
Yes, we're working on waiving as many fines and penalties as we can through executive order. But when the General Assembly comes back, we have already talked to them about delaying in statute these things that we can't change through executive order. We want to discourage people from going out and having these exchanges for things that could be delayed a few months. So I think that when the General Assembly comes back, you will see some action on that and other things that in the law require people to go out and personally do things when we want to try to curtail that kind of activity. Thank you. Next question.
This will be our last question. Chandler Morgan, WBTV.
Hi, Governor. My question is actually for either Dr. Cohen and also Director Sprayberry. Just some clarification on the new measures for nursing homes since they're required to wear face masks. Is that considered N95 masks or will homemade masks do? And if the N95s are, what's required? Are you all going to be playing a role in making sure they get those? And then the second portion of this was just about the FEMA housing program. Director Sprayberry, how would you be able to ensure that people are being separated in those facilities? Because I know that some people are people who have tested positive for COVID-19, and then some of them are people who you're trying to make sure don't get COVID-19. How would that work?
Sure, thanks for the question. This is Mandy Cohen. I'll address the issue around face masks. So there are several different kinds of face coverings or face masks that folks can wear. When I'm referring to face masks at a nursing home setting, it is a healthcare setting, so we do want to have folks wear what is called a surgical mask or a procedural mask. An N95, a level 3 N95, is really something that is recommended really in a hospitalized setting when folks are doing aerosolized procedures. Other than that, the surgical mask or those kinds of health grade face masks are used to prevent the transmission of droplets, again, both for the patient and for the healthcare worker. We're not talking about in a healthcare setting using homemade masks, which is different than what the CDC might be recommending for you or I as we're at the grocery store or out and about if we wanted to wear some sort of face covering that might be something that is homemade. When we're talking about our long-term care and nursing settings or healthcare settings, we're talking about health face masks that are approved by the FDA and have some certain components to them that are appropriate for them, but they are not N95s. I'll let Director Sprayberry talk about the FEMA issue.
Thank you for that question. And so you're talking about the Emergency Non-Congregate Care Program. And the way that we anticipate that's going to be implemented is that North Carolina Emergency Management, working very closely with the Department of Health and Human Services, would also assist our local partners at the local health departments and their local emergency managers to operate this program. And we would assist them as they put people in hotels and dormitories, and it would be how they would keep them apart. And I think that folks that would be going into these places would have a vested interest in keeping separate. And so they, at the local level, would be managing that, and we would be providing assistance. Thank you.
We thank you for being with us today, and we also want to close by thanking all of the people, as Dr. Cohen and Mike have said, thanking all of the people who work at our long-term care facilities and our nursing homes. I've always thought that even under the best of circumstances, that they were doing the Lord's work. And it is so much harder now as we face this pandemic. We're grateful for their good work. And I know that this team, we're going to do all that we can to try to protect you and your patients. And thank you for being with us, and we'll probably talk to you tomorrow. Thank you.